If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Today on To Your Health, eating disorders. The most common forms include anorexia, bulimia, and binge eating, and are all serious, potentially life-threatening conditions. According to the National Eating Disorders Association, 20 million women and 10 million men in the United States have a clinically significant eating disorder during their lifetime, and less than 10% of sufferers seek treatment. More and more young children are also becoming afflicted. Eating disorders have the highest mortality rate of any mental disorder. Today, we'll hear from an eating disorder therapist, a nutritional therapist, and a former Miss America who's going to share her personal struggle with anorexia, how she overcame it, and what she's doing now to help others. That's all coming up next on To Your Health. Hi, I'm Portland Helmich. Eating disorders can have serious consequences to your health, productivity, and relationships. They can be chronic, debilitating, and even lead to death. Early diagnosis and intervention can go a long way to enhance recovery. The most effective and enduring treatment is some form of psychotherapy coupled with careful attention to medical and nutritional needs. Joining us today to talk about the warning signs and some of the myths about eating disorders is Allison Jupiter. Allison is a New York State licensed clinical social worker and certified eating disorders specialist and therapist. Thanks so much for being here.
Thank you for having me.
So I think we all know what I think we all know what an eating disorder is, but is an eating disorder a mental disorder?
It can be. It's a combination of a medical and a psychiatric disorder.
And what are the different types of eating disorders? I think most people think of anorexia, but that's not the only one.
No, there's a bunch of eating disorders out there. I'd like to give an example, if that's possible.
Sure.
So if you were to have a friend who had an eating disorder and you were to bring them a birthday cake for their birthday, they're going to see that birthday cake very differently than you or I. Someone with binge eating disorder, which is one of the eating disorders, is going to look at that cake and be like, I can't only eat one piece, and I feel really badly about that. Someone with anorexia is going to look at that piece of cake and be like, I can't have this. I can't engage in this. I don't even want to go to the birthday party.
Evil.
That's evil. It's going to make me fat. I want nothing to do with it. And someone with bulimia is a little bit in between those two people. That person may have a piece of cake, but then they're going to compensate for that in some way, whether that be over-exercising, purging, laxatives, taking Adderall, cocaine, etc., to get rid of it somehow.
What are the health consequences of eating disorders over the long term?
Well, each one has its own unique medical consequences. For anorexia, you will lose your period, which could affect fertility. It also can affect estrogen levels. It can affect your bone density, osteoporosis, osteopenia. You also could have low heart rate, which can lead to cardiac arrest, low blood pressure as well, dry skin.
Freezing cold all the time.
Freezing cold all the time. You can lose your hair. For bulimia, it's a lot of the same consequences, but you'll have teeth erosion from the acid.
Wow.
From purging. You also could have electrolyte imbalances, which could lead to cardiac arrest as well. You can have gastroparesis, digestional problems. And for binge eating disorder, if you are overweight, you could have high cholesterol, high blood pressure, a lot of the medical effects that go along with being overweight.
So when I think of who's most affected by eating disorders, I typically think of young women.
That is what most people think, but that's a fallacy out there.
Really?
There's been people, I've had people as young as 6 years old in my practice all the way up.
Wow.
It really can affect anyone. And what they say with the statistics is 50% of elementary age school girls already worry about their weight.
That is so screwed up.
Yeah.
That's the culture we live in.
That is the culture that we live in. And teenagers and college-age women, 50% of those women have engaged in at least one eating disorder symptom at one point in their life. So it really affects anyone and everyone at any age. It's really about control.
But obviously there are more women suffering from eating disorders than men.
The statistics show that 20 million women and 10 million men suffer from an eating disorder, but I think men, it comes out differently than women. Men tend to have more bigorexia,
What's that?
Bigorexia is where people will take weight gainers. They'll spend hours at the gym. They want to be bigger. They don't necessarily want to be thin. And for men, it also depends if they're athletes. If you're a runner, if you're a gymnast, if you're a jockey, then you have to maintain a certain body weight, and they will do interesting things to maintain those body shapes.
Mm-hmm. What's interesting?
Binging, purging, weight gainers, laxatives, all the things that you hear women do, men can do as well.
Well, that's the next question. So why do people develop eating disorders?
You know, it's really multidimensional why people develop an eating disorder. You know, in the statistics that I've seen and the research that I've done, there are hereditary estimates for twin studies, meaning both twins will develop an eating disorder, anywhere ranging from 48 to 83% of both twins will develop an eating disorder. So you put the biology with that, along with a parent who's on and off of diets, who may have an eating disorder themselves, a father who might objectify women in some way, and a brother that teases you as you're going through puberty and your body's changing, and all of those factors can go into it. Also, if you grow up in a family where there's trauma, physical abuse, emotional abuse, or sexual abuse, which the statistics say that 30% of eating disorder patients have been sexually abused, and I personally think that number's higher because so many of my patients were drunk at the time. They knew someone they knew.
What do you mean drunk at the time?
They were assaulted.
Oh.
And then they develop an eating disorder in order to manage those feelings. So those numbers, I think, for sexual abuse are much higher than what's actually put out there. So you put all of those factors into what's going on, along with the media and social media out there, it creates the perfect storm for someone having an eating disorder.
What do you think some of the biggest myths about eating disorders are?
That it does only affect young people, that you have to be what you see on television almost, 50 pounds on a feeding tube, or 600, 700, 800 pounds. Most eating disorder people look normal, or they look just a little too thin, or a little bit overweight. I think that it also, one of the other myths is that it only affects upper middle class white women, and that's not true at all. It affects all cultures, all religions, all races. It really does go across all cultures.
And this is personal to you.
It is personal to me, yeah.
Right. So you yourself have suffered from an eating disorder.
Yes, 30 years ago.
30 years ago.
30 years ago. I was 10 years old.
Are you serious?
Yeah.
My goodness. And what turned it around for you?
You know, I was very lucky. My mother was a nurse, and she caught it right away. And my parents put me in treatment from a very early age.
And was that psychotherapy and nutrition therapy?
Psychotherapy, nutritional counseling, medical management.
Do you think that that's the best approach to treatment, psychotherapy and nutrition?
Yes, definitely. And most people are able to do it on an outpatient basis, I should say, which is how I conduct psychotherapy for my patients, which would be like once a week individual therapy, once a week group therapy, family therapy. But if someone is not medically stable, or they're not able to go to school, or they're not able to go to work, then you might really need to consider a treatment program, which can be anywhere from several days a week, after school, after work, to going to a 30-day plus rehab facility.
So when you're treating someone, are you working with what they eat, or are you working with how they think about what they eat or don't eat?
I'm working more with how they think. I really refer to a dietitian in order to deal with the food portion of it. I try to ask them, my patients, why they're doing it. What are their external triggers? What are their internal triggers? How can they gain better coping skills so that they don't have to go to food in order to cope with stress, in order to cope with depression, in order to deal with feeling out of control in their life in some way. And so I help them try to learn how to live a better life and get what I call their toolbox, so that they can pull from it instead of pulling from these coping mechanisms.
So if someone with an eating disorder requires a team to help him or her, a nutrition therapist, a psychotherapist, medical doctor, how do you all work together?
Well, a lot of phone calls, a lot of emails. I really work more with the mind. The doctor works with the body. The dietitian works with the food. And so, what we'll try to do is the dietitian will look at meal plans and analyze them and see if there's any emotions that come up, and say, talk to your therapist about that. I'll talk about anxiety, depression, anger, school stressors, work stressors, whatever it is going on. And the doctor really deals with taking the blood work making sure that someone's medically stable, to make sure that they don't go into cardiac arrest or something. Because the scary thing about eating disorders, I do want to say the medical piece, which is really important for me and for the dietitian, is you're only as good as your last bloods. So I've heard stories of
You're
people...
only as good as your last blood?
Your blood work being taken. People will get their blood work done the day before, and then they'll end up in the emergency room for cardiac arrest or electrolyte imbalances or things like that. And that's when it becomes really serious. And that's where I'm not able to do, because I don't have the medical background and really more the psychological.
Do you find that it's useful for people who have an eating disorder to work not only one-on-one with someone like you, but to be in a group with other people who have eating disorders?
I actually run a group for women, young adults who are suffering from an eating disorder and recovery. And some of them have said that's the most helpful thing, to know that they're not alone, to know that what they're thinking is not so abnormal. A lot of them think that they're crazy and no one else thinks or feels the way they do. And so when they meet other people who do, they feel so much more comforted and not alone. And that support is maybe one of the number one things in recovery.
Yeah. If you suspect that someone has an eating disorder, what's the best way to approach him or her?
The best way is to tell them that you care about them. Tell them that you're not going to judge them. Tell them that you're there for them, that you're worried about them. What you don't want to do is say, I know you have an eating disorder, you need to do something about it.
You're anorexic.
You're anorexic, you need to eat something. You know, you could stand to gain a few pounds, or you could stand to lose a few pounds. Do you need that extra piece of cake? That's not the way. It's to show someone compassion. It's to show someone non-judgment and let them know that you're there for them no matter what.
If you're struggling with an eating disorder, how long might it take before you begin to reverse the damage?
This number might be scary to a lot of people out there, but recovery is possible. The statistics show 7 to 10 years to get over an eating disorder.
Are you serious?
Mm-hmm.
So you said 10 years old. Did it take you until you were 17?
It took me, depends what your definition of recovery is. For a lot of people, recovery is not engaging in symptoms. For some people, it's a higher level to not worry about your body and, look in the mirror every single day and love your body. What woman has that? What man has that? So it depends really what your definition of recovery is. But yes.
Wow. But do you feel like you're recovered now?
Absolutely.
And what does that mean? So you're able to go out to eat and you don't worry about it? You don't live on the scale?
No, I don't live on the scale. I exercise moderately. I eat what I want. I love cookies and ice cream, and I will eat a birthday cake, maybe even have 2 pieces if I wanted to. But, I feel really healthy and I'm happy.
I bet you do really good work with people then, because
Well,
you
thank
know
you.
where they're coming from.
Yes.
Yeah, there's hope.
Yeah, absolutely.
Thanks so much for being here.
Thank you.
Coming up next, we're going to talk to a nutrition therapist who specializes in eating disorders, and we're going to learn how she crafts nutrition plans to help patients recover and restore their health. We'll be right back. Welcome back. Today we're talking about eating disorders. With us is Limor Baum. She's a nutrition therapist specializing in eating disorders. Limor works with individuals and families to help develop healthy behaviors around food, body image, and fitness. Limor, it's so good to have you here.
Thank you for having me.
So how important is nutrition therapy to someone who's dealing with an eating disorder?
It's very important. I really see it as a very essential part of the treatment with the therapist, with the psychiatrist, with the primary care physician. Nutrition is valuable.
So how do you work with someone who has an eating disorder and is seeking out nutrition therapy?
So first of all, it depends on the diagnosis. I do see people with anorexia, with bulimia nervosa, with binge eating disorder. So the approach for therapy is obviously different depending on the diagnosis. But I find that, around those 3 diagnoses, it's really about making peace with food and with eating and with feeding your body and taking care of it. So we really work to achieve those.
And how do you work differently than a psychotherapist works with someone with an eating disorder?
So I really see my job as focusing on the food. Indeed, a lot of the work that I do is more therapeutical, but it's always surrounding the food. So for example, it's about your eating behaviors as a child with your family. How were the eating behavior of your moms, for example? How did they react when you wanted to eat that second plate of food?
And if someone has an eating disorder, what do you want them to understand about food and nutrition?
So first of all, I really want them to accept all food groups as a healthy part of their diet. A lot of people with and without eating disorder believe that certain food groups are not healthy. Carbohydrates, for example, fats, so sugars, which are part of the carbohydrate family. And so the first stage is really educating them and explaining them why our body needs sugar and carbs and fat, and it's actually essential. We cannot survive without them. So that will be really the first part. Why do you need to have them? How essential they are.
And what happens to someone's body when they have an eating disorder?
Yeah. So for example, with someone with anorexia, where she restricts her food intake a lot of the time, we're talking about a very low weight. We can talk about bone mass loss, disappearance of your menstrual cycle, lower heart rate, lower blood pressure, fatigue, weakness.
Even fainting spells
and
sometimes.
Fainting, absolutely.
What does it take to regain your health? So if you're someone who's maybe anorexic and you've lost, I don't know, 30, 40 pounds and you're really weak, what does it take?
Yeah, it takes a lot of effort, because absolutely, in order to gain the weight back, you need to eat a lot of food. It's not about eating, another snack a day. We can talk about eating 4,000 calories a day in order to gain 30 pounds.
But would that be a lot for someone who's been so restrictive to all of a sudden eat a lot? I would think that would almost make you sick.
It's a lot of discomfort. And I always say to my clients, in order to gain the weight, you need to feel discomfort. Oftentimes, especially at the beginning phase, the refeeding phase.
So you start them out with 4,000 calories?
Absolutely no. So no, not at all. But we'll start, if someone eats 800 calories a day, we'll start with increasing it by 400 calories. But what we see all the time that we add 400 calories, it's not enough. Like she may gain a pound or two and will not continue to gain. So slowly, we increase the amount. And then it's not uncommon to see 3,000 to 4,000 calories intake a day.
And what are some of the greatest challenges that you see people with eating disorders face when it comes to regaining their health?
A lot of challenges. I would say the biggest challenge is really the first year of recovery. I mean, this is also when we see a lot of relapse happens. We don't know exactly why, but we do think there is also a neurological or brain reason why that works like that. Is that basically, again, we're taking the anorexic client here as a case study. What often happens is that her brain is really telling her, do not eat. It seems alarming to the client to eat that bowl of pasta right now. And again, there is a lot of fascinating neuroscience that look into that right now, why it happens, but it's really scary and anxiety provoking for many of the clients to eat their meals, to eat what we will perceive a very healthy, regular meal. They perceive it as alarming.
And I know one of the things that you work with is intuitive eating with people who have eating disorders. So help me understand that.
Yeah. So intuitive eating is really, it's not about a meal plan and have this amount of carbs and fat. It's really following your own craving and needs and
noticing when you feel hunger.
Absolutely. So a lot of the time we start by having the client filling a chart about her hunger and fullness cues, paying notice and developing awareness into her body's cues. One important thing to remember is that it's not recommended usually to start it as the first line of treatment. So if someone comes severely malnourished at 80 pounds, her cues may be a little bit unregulated, or they may be complete block between her hunger cues and what she senses. So it's really after someone is regaining the weight or stop binging and purging that I introduce the intuitive eating phase.
So there are obviously a range of eating disorders. As a nutrition therapist, how do you deal with them differently?
So the main three eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. I would say the one common theme for all of them with the nutrition therapy is creating a meal plan and creating structure and consistency throughout the day. And it's so valid for each of these diagnoses. So it's about eating about every 3 hours. And most importantly, is about balance in each meal. So I often talk with my clients about incorporating carbohydrates, protein, fats, vegetable, or fruit in each of the main 3 meals, being breakfast, lunch, and dinner. And then we also talk a lot about snacks and incorporating 1 to 3 snacks a day, again, to create a very structured meal plan, eating every 3 hours or so.
What do you do when you encounter resistance, when you have someone who's like, I can't do that, I can't eat that much?
Yeah. It's a very common issue. So, the first thing is that I take baby steps. So maybe if someone eats 1.5 meals a day, it won't be immediately 5 meals a day. It will start with adding 1 meal to the day. And also a lot of the times, if a client, for example, doesn't eat carbohydrates, she has a very strong fear of carbs, we will start with the easiest thing or the safest thing for that client. So maybe just grapes or a cantaloupe, and starting with that, instead of starting immediately with a slice of bread, we start with that and we slowly build up. It's a long process.
Mm-hmm. But you see people get better.
I do see people get better, absolutely. And it's very empowering.
That sounds really important.
Mm-hmm.
Important work that you do.
Thank you very much.
Yeah. Thanks so much for being here.
My pleasure.
When we come back, we'll talk to a former Miss America, Kirsten Haglund, who suffered from anorexia and found healing through therapy and faith. Stay with us. We'll be right back. Welcome back. Kirsten Haglund was crowned Miss America in 2008. She was the embodiment of beauty, health, and promise. But just a few years earlier, Kirsten was a ballet dancer, in denial of the fact that she had a serious eating disorder. She was anorexic, and her life was spiraling out of control. She could have died, but it was her parents' intervention and her faith that pulled her through. Today, Kirsten is fully recovered and thriving in her life and her career. And now she helps others with eating disorders through the Kirsten Haglund Foundation. Kirsten, it's so good to have you here.
Thank you for having me.
So how was it that you developed anorexia? When did it start?
It started when I was about 12 years old. That was when I first started to exhibit some of the symptoms. However, it was kind of this perfect storm of factors leading up in my life up until the age of 12, because, they say in the eating disorder field that genetics load the gun and environment pulls the trigger. So, kind of that it's a mix of biology and environmental factors. And I was a perfectionist growing up. I was the good kid. My older brother struggled with some things, and I was the good girl. I was very much an overachiever and had big dreams for myself and big ambitions, and kind of was that type of person that would push myself to go to whatever lengths in order to be successful. I was also a people pleaser, always wanted to make sure that everyone around me was happy and that I was pleasing everyone, and would actually do some things that were at a detriment to myself in order to make sure that other people were happy. So all of that, coupled with the ballet world, which elevates a very thin body ideal to this, this very high standard for all the young women that participate in ballet. It was just the perfect storm.
So what did you do? How did you restrict your eating? Did you eat a certain number of calories, or only at certain times, or only a certain food?
Yeah, well, you know what? A lot of times we don't talk about specific behaviors. I ate X amount of calories, or, I got down to this number of weight, because so many young people listen to people that are recovered and listen to their stories, and they hear those numbers, or they hear, oh, she did exactly this or exactly that, and they either copy those behaviors, or they think, well, I'm not eating that many calories, or I'm not to that low weight, so I must not be sick enough in order to get treatment. And it's a huge misconception. So I will refrain from, detailing all of my behaviors, but to say that I was not adequately nourishing my body for what it needed to just live every day, to a point where by the time that my parents stepped in and got me treatment at the age of 15, I was a shell of my former self, both physically, but also mentally and emotionally. And that is one of the, besides just looking at someone saying, oh, you look like you have an eating disorder, some of the biggest factors and the biggest red flags are the mental and emotional changes. I mean, I went from being this bright, bubbly, happy girl to being very depressed, isolating myself, not wanting to be anywhere around foods. That meant no parties, no socializing, and just this very controlling, obsessive personality. And that's when my parents really realized our daughter is a completely different person.
So it was really their intervention that turned things around.
Absolutely.
Okay.
Yeah.
And so what was the intervention? What was the main treatment that you followed?
I didn't, at the very beginning, I did not want to get help at all. And I knew that there was something wrong, and I knew that I couldn't stay living like this forever. but I was so terrified of getting help. I was so terrified of getting treatment because it wasn't just that I was afraid that doctors or treatment was going to make me get fat. You know, I was also afraid of losing control. I had created this perfect little life for myself with food, weight, calories, but also my performance and my obsessions, that I was afraid of losing that control. And so it was really my mother who made a doctor's appointment for me and, you know, took me there and made me go in. And of course, the doctor knew exactly what I was dealing with due to my symptoms. And we got set up with a treatment team of doctors in my hometown in Metro Detroit, Michigan, where I grew up. An eating disorder specialist, a physician, as well as a nutritionist and a psychologist. You know, it's mind, body, and soul. It's all of those things working together. You can't just see a doctor, go in and, you know, get a feeding tube and get to a healthy weight. I mean, this is a mind, body, and soul issue. All that needs to be treated together. So I had a really great treatment team, and at first was very resistant, but by about 6 months into these regular weekly appointments, I started to actually work with my treatment team.
And was faith a part of this, a part of the healing process?
Yeah, oh, absolutely. I mean, I don't think that I could have gotten better without my faith. I opened up the Psalms and really started to pray through the Psalms, and that was really where I started to finally feel like, you know, there's someone in this struggle with me, you know, and I don't have to do this alone.
Not alone is a big part of it.
Yes, and so that was a huge part of my recovery. But I will say, and there's a lot of Christian women that struggle with this, you know, feel like if they're struggling with an eating disorder, or a person of any faith feels like I can just go to see my pastor, I can just go to see my, you know, my faith leader or whatever it is, and they'll help me. Yes, that's such an important element of it, but you've got to have the professional support because this is also a medical issue. So you need to be medically stable. It's very important to have all of those pieces of the treatment team together. It's not a phase. You don't just get better by talking it out. You have to include the physical nourishment as well.
That's really important. So when was it that you started to feel like, okay, maybe I'm turning a corner. Maybe I'm gaining a little bit of weight. I'm not terrified of food. I'm starting to get a little bit better.
Yeah, well, you know, it is a really hard process. I mean, I think anyone who has tried to recover from anything, whether it's addiction or an eating disorder or personality disorder, you take 2 steps forward and then you take 3 steps back, and you take 2 steps forward and 1 step back, and it's this constant process. But I think I realized, you know, the physical is something that, you know, yes, you start to enjoy cooking again, and you start to get nourished again, and your brain starts to change in that way. But the real markers, I think, of progress are really starting to live a life where you wake up every day and you accept and are content with your body, with your situation, where you are in recovery, even if it's not perfect. So really waking up and saying, I can choose to be content today. I can choose to love my body today the way it is, choose to be thankful and have gratitude rather than always seeing the negative. And I think when that started to be more of my default setting rather than the constantly picking apart my body and myself as a person, was when I really felt like, okay, now I'm in a stable place where I've got the tools in my tool belt, so to speak, to make sure that my recovery lasts a lifetime.
So what advice would you give someone who's struggling with an eating disorder?
Oh, you know, I can remember from my own experience, I mean, just really, really dark days where you don't believe that full recovery is possible and that you're in this battle all by yourself. And I would say to those people that I am here as a living example that recovery is possible. And I can tell you that it is. So please do not give up hope, even if you relapse, even if you have a bad day, right? And in an eating disorder recovery, that it's so important to know and to keep pushing, because true freedom is possible and you can recover from these illnesses. The other thing, the other little bit of advice or wisdom is to make sure that you've got a support team around you of people that really believe in you, and get rid of toxic people in your life, because they're just not worth it.
And as we're wrapping up, just tell me, what do you do with the Kirsten Haglund Foundation?
Sure. So at the foundation, we raise money for treatment because there is, it's very expensive to get treatment. There is a large, usually gap between what the family can afford and what insurance will cover. So in addition to educational events and raising awareness of this disease, we also raise money for scholarships. So we can provide treatment grants to those families to help those individuals get a second chance of life and get the treatment they need, because that's what leads to full recovery.
Well, you are a great role model.
Thank you so much.
Thanks for being here. That's our show for today, everyone. Please check out our show page for more information on this episode. Thank you so much for watching. Till next time, here's to your health.